Yep.
I guess it's technically time.
I give it a few minutes, even though
Okay.
it's live stream, because people are moving between sessions.
Yeah. Hello. Oh, hi. Oh, great, thank you. Okay. Hi, everyone. Thanks for coming to Governor's Plaza, room 15. Welcome to our session. The title is Transforming the County Behavioral Health Intake Process, Offering Bridges to Care, Lessons from Monterey County. But in this session, we'll actually focus a little more on how a collaboration between a statewide initiative, County Behavioral Health Agency, and Credible Mind, a mental health digital self-care platform company, introduced a screening tool that has helped thousands of Monterey County community members to date. So first, you'll get to know a little bit about us. You'll get to know a little bit more about Monterey County and the county's behavioral health agency. You'll get to hear about the state funding and support behind this project. You'll get to hear how the project unfolded and the impact and lessons we've learned so far. So with that, we'll start with introducing ourselves.
Hi, my name is Shamar Clements, and I'm the Research and Data Coordinator at Credible Mind. I have an MSW, and I've been working with Monterey County on this project throughout the needs assessment and implementation phases.
And I'm Melissa Malo. I am the Director of Content Operations at Credible Mind, and I've been the project's primary project manager for the past almost 2 years now.
And I'm Jeff Blood. I am contracted working with CalMesa, the California Mental Health Services Authority, as an implementation manager. And so I've been working with Monterey County on this project and doing the administrative support of the project and coordination with Credible Mind.
Hi, and I'm Wes Schweikart. I'm a management analyst with Monterey County Behavioral Health, and I serve as the Mental Health Services Act Innovations Manager.
All right. And Wes, would you like to tell us about Monterey County?
Okay, I'm here with the Monterey perspective. So for background, Monterey County is a coastal county in California. We're a couple hours south of San Francisco, an hour south of San Jose and Silicon Valley. We are categorized as a medium-sized county with 433,000 people. Our demographics include 59% identifying as being Latine and 48% speaking Spanish, which is notable for this project and most of our services. And we are geographically split into 4 regions. So most people are familiar with Pebble Beach, Carmel, and Big Sur as pictured. But we're a very large geographic county, and that consists of the Salinas Valley, which is very long and consists of the city of Salinas, the county seat, which is about 200,000 people, and then several towns of 20 to 30,000 people, 30 minutes apart from each other. So Monterey County Behavioral Health, we are the safety net provider for Monterey County residents. And what that means is we serve those who are Medi-Cal recipients and uninsured individuals. And we also serve those with moderate to severe mental health acuity needs. So those with greatest need come to us. And then we contract out with a multitude of providers who then provide additional prevention and early intervention services, and also service those on Medi-Cal with mild to moderate needs. And this graphic here on the right characterizes our system, which has 5 different branches to it. There's the adult system of care, the children's system of care, substance use disorder programs, crisis services, and then access to treatment. And kind of as a whole, we in fiscal year 21-22, we served 13,150 individuals with an average service value of $7,820 and 4,400 new clients that year. And the access to treatment system, which is comprised of our 4 walk-in clinics that are spread out throughout the county, they serviced about half of that client count. So they served over 6,000 individuals, and of the new clients, they served about 75% of that 4,400 amount. So access to treatment is literally and figuratively our front door. to talk more on the Help at Hand initiative, of which this project is a part of, I'll bring up Jeff.
Thank you, Wes. And thank you all for your time this afternoon. I just have to say that being part of this project with Monterey County Incredible Mind has been such a privilege and has really fed my love for both healthcare and technology, and most of all, seeing the impact that the project is having. But I want to provide a little background on Help at Hand. This is a statewide program in California, and it's a technology innovation initiative that started back in 2018. And it's being administered by the California Mental Health Services Authority that we refer to as CalMesa. And we are supporting 14 counties and cities through this project. And so this is one of many projects that are under the umbrella of the Help at Hand program. And it's funded through the Prop 63 Mental Health Services Act. And for the Help at Hand program, one of the services that CalMesa provides is to procure the apps that are implemented, and also managing the project funds on behalf of the member cities and counties. Collectively, we refer to these cities and counties as a collaborative. And we do that because we're learning from each other. And we remind ourselves of this frequently, because there's an innate tendency where we want to implement something. We want to complete the project. And so that certainly is a goal. But since this is technology innovation, part of innovation involves trial and error and learning from that. And so it's been fun to be part of that, and learning collectively from all of the member cities and counties and the work that they're doing. And ultimately, we're hoping that we're testing and developing unproven mental health models that become tomorrow's best practices. So with these projects, the collaborative established 5 learning objectives at the outset, and these serve as a guiding light or path for each project. So each of the projects that are under the Help at Hand umbrella are meeting at least one, if not multiple, learning objectives. I'm not going to go through and read each one, but just wanted to reference that we set these in place at the beginning to guide us along that way. And now I'm going to pass back to Wes, and he's going to provide more background on the project.
All right, project background. So the short version here is that our problem is that demand for services are outpacing the capacity of providers. We're having bottleneck into our access to treatment system of care specifically. And the solution that we put forward through an MHSA Mental Health Services Act, MHSA Innovations project as within Help at Hand, was to develop an online screening and referral tool that identifies potential mental health conditions and connects users to local and online resources. So in essence, let's help reduce that bottleneck by, at an earlier stage, further upstream, efficiently navigating people to the right place to go. So for more context on that, this project started to come to fruition back in around 2018, which is about in the middle of that bar chart there. And that chart reflects the total client count of individuals seen by Monterey County Behavioral Health. And you can see it really climbs from 2012 up to 2017, 2018. It nearly doubled. And during that time, our staffing didn't change. So twice the clients with the same staff isn't the best equation. And then as we got into 2020 and the COVID era, there's a lot more burnout and turnover, and so the staffing capacity issue worsened while demand stayed the same. And then related to this, as I alluded to before, Monterey County is a pretty geographically spread out county, and there's a lot of areas that don't have any providers nearby. So that's kind of the volume issue, and related to that is the task, the work duties associated with that. So Monterey County, we serve those on Medi-Cal or those uninsured with the moderate to severe needs. And if people don't meet our requirements, we refer them out to one of our contracted providers. And so it kind of creates a pathway that isn't so desirable for would-be consumers. And for our staff, it's just, more time is allocated towards that triage and intake and linkage and referral piece, as opposed to providing direct therapy services. So we really wanted to kind of hopefully change that equation, minimize that intake process, maximize time spent towards therapy. And a part of, related to that, we are Monterey County. People know about us, but they may not know about all of our many service providers in the community. So there's also that need that factored into this project as well. So then getting to the solution, we wanted our online screening and referral tool to identify potential behavioral health challenges and connect users to relevant local and online resources. And so to increase their access to behavioral health care and education, and also aid in optimizing clinical staff time. So we were thinking, if we have people filling out this assessment, which we'll get into further, and that, they're putting the work in. And so when they go into the clinical office, they're going to be going through the in-person assessment as well. That's just kind of what needs to be done. But our hope was that having this screener filled out ahead of time, that could be something that could be referenced by the clinical staff to basically get a heads up and better understand how to efficiently use their time with that client and maybe hone in on certain areas. And so from the project plan, our vision or requirements were to build this tool from validated scales, existing validated scales. Include screening for anxiety, depression, PTSD, substance use, bipolar, and psychosis. Have it operate in English and Spanish, as Spanish is a threshold language in Monterey County, and have it be anonymous and confidential to encourage use of the tool. To talk more on the collaboration with Credible Mind and the product, I'll bring up Shamar.
Okay, so we'll get started first with just a project timeline, a brief overview of how this all came into fruition. So August 2021 is when we kicked off this project. There was a very extensive needs assessment phase, which I'll go into a little bit more, from September through March. And then we developed the tool, like all of the technical aspects, actually creating the website from March through July. We did an on-site validation in Monterey County, testing the tool, making sure it had the right reliability and validity, July through November. And then product launched November 15th of last year. And since then, we've been focusing on marketing and outreach. So some of the things that are important have been, through all of those phases, have been the community involvement. Credible Mind, we are a mental health tech company that is not based in Monterey County, but we made sure that we had a very extensive research process and a collaborative process throughout the whole project to make sure that we were suiting the needs of the county. So for example, during the needs assessment we had informant interviews and focus groups with access providers, the people who are, those people who are the front door for the mental health services, other Monterey County behavioral health staff, professionals from other community agencies such as United Way in Monterey County, Sheriff's Department, youth centers, things like that. and also youth and adult community lay members, just people, living and working in the county. We also did a survey that had 93 respondents. Some of our major findings were that for staff particularly, there was an issue with the familiarity with the community resources. So, like Wes mentioned, there is a specific demographic that MCBH services, and then a lot of the people that do come in through those access doors have to get referred out. As I'm a social worker, so it's very common for there to be very kind of like dated binders or like lists of what resources you refer people to. And so those are hard to keep up to date. People don't always share them with one another. People don't always know, what's out there for the people that they're serving. And then also with the community members, we recognize so much in what came up in conversation and survey were the barriers to accessing care. So people either not having transportation, living too far away from the services that they needed, language barriers, availabilities of provider, and stigma, of course. Something to note is that, again, it's a very agricultural and migrant community in Monterey County. So culturally, there are going to be some segments of the population that are pretty far removed from some of the behavioral health and mental health supports that are common to some of us. So in tool development, we also did user testing with community providers and members, and then on-site validation, like I mentioned. We went down to the access clinics. We offered incentives for people to take the screener once we had developed it and give us feedback. We could observe their process of, engaging with the website. And also, we were able to compare the results that they received from our online screener to what they were receiving from the people that they were seeing in person, the providers, to make sure that our recommendations were in line with something that they might get from someone who was seeing them in person. So, with all of that feedback that informed our development, these are some of the things that were kind of shifted or taken into consideration as we implemented this program. So, we designated a minimum age of 16. Part of that is for, like HIPAA and confidentiality and all that jazz. Also, because we are using validated scales to build out this screening tool, most of those are validated within an adult population. So for that accuracy, we wanted to make sure that we are targeting the right population of the community. We did notice now that the project has been implemented that there are many people under age 16 who are accessing the site wanting to take the screener. What we've done for this instance is they'll answer, just some of the intro demographic questions. Once they say what their age is, they're redirected to a page of local youth resources in the county instead of taking them through the whole screener so that they can still access some information if that's what they are needing at that time. We added 2 conditions, postpartum depression and eating disorders. It came up in a lot of our conversation as needs for that particular community, so we were able to add scales to assess for those things as well. We implemented lots of features for anonymity and confidentiality. Again, for people who are struggling with stigma against receiving services in mental health, or living with family, or living in other residential situations that lack privacy, or things like that. We wanted to make sure that people felt like they had a way to access the tool and to feel safe and to feel empowered to do so. So some of those features include the fact that there's no contact information stored with a person's results, and that users can share their results with others or re-look at them themselves by just having a results code. So it's a 6-digit code that you get once you complete your screener. You go back to the site, you type it in, and you can see results. It doesn't have your name on it, it doesn't have your birthday, anything like that. It's just a de-identified code, which ensures confidentiality. And then some of the other things that came up through our needs assessment process were other, again, barriers to access, even for this website. So we know that this project is not going to be the end-all, be-all solution for fixing the supply and demand gap for mental health. But as a tool that is digital, it does increase access. But again, in this community, there are people who do not have access to the internet or devices or things like that. So some of the things that we've worked towards are purchasing tablets that will be placed in public locations so that people are able to take this screener even if they don't have a smartphone or a laptop. And again, they can just store their code, write it down, whatever they need to do, and be able to access it any other time that they can get back to the website. We've also shifted our marketing strategies to do things like radio, bus, distributable business cards. Everything is bilingual, so just to make sure that we're reaching the community as we intend to. And now I'm just going to go through a couple of screenshots to demonstrate what the site looks like, what the solution is visually, and you can kind of get an idea of how a user experience might be. So this is our homepage. As you can see, it's already a accessible experience for both Spanish and English speakers. We have the intro to the screener in both English and Spanish. There's also a toggle on the page where you can shift all of the language on the page to either English or Spanish, but if someone happens to access the page in English but needs to do it in Spanish, they can still obviously see how they can do that here. Under that, you can see after where it says already completed well screen, that's where you enter your results code. And that's what I was mentioning, the 6-digit code. Either someone has already taken it, maybe they wanted to share their results with a friend, maybe they wanted to share their results with the access office, maybe they want to share their results with a psychotherapist that they already have. Anyone in Monterey County can go to the site. If they receive a results code, they can type it in and see both a user view or a clinical view. And then some of the assets that we have at the top, which are really important, are the first tab, the Need Help Now tab. That's going to catalog information for both national and local hotlines so that if someone is in crisis, if someone is taking the screener and is like, I need help right now, they can click on that, see who they can call, and receive more personalized help. Monterey County Resources is going to catalog some of the local resources in the county that we have identified the information for and created a directory of sorts here. So again, as Melissa mentioned, Credible Mind, what we do more broadly is we are a digital directory of self-help resources. And so that includes things like books, podcasts, apps, videos. So this is information that is provided to the users of this site, but also in conjunction with that, we are giving them access to information around what's available in their local community if they do decide to go seek in-person services. And then we have FAQ questions so people understand the use of the site. So screener takes about 15 minutes to get through, depending on someone's introspection and digital literacy and things like that. Then they get to the results page. So it's broken down into areas they're doing well, areas of some concern, and areas of greater concern. And you can see some of the areas that we assess for there. Our screener uses branching logic so that people aren't asked questions that they don't necessarily need to be asked. Like you'll start off, have you been pregnant? Have you been pregnant recently? Are you pregnant now? If you say yes, you'll go into the postpartum depression screener. If you say no, you won't have to take that portion of the screener. So trying to make it a streamlined process for each user. And I'll show you right after this if you click on any of those, you'll see more information about it. I'll show you that soon. And then there's what to do next. So anyone who scores in an area of greater concern with any of the different conditions listed will get recommended to seek out support from Access, since they might fall into that moderate or severe need category. And so we have all the information there about location and hours, phone numbers, make it really easy for the person to be able to get in contact with those services that they might need. Again, their results code, which they can copy, text, get emailed to them, and then also an opportunity to try out some self-care approaches if that's what they're looking for at this time. This is an example of the results page, and this is for PTSD, but you can see the person can see where they scored on that scale. They get some psychoeducation around, the different symptoms and help, empower the person to have vocabulary around what they're experiencing, be able to advocate for themselves once they see a provider, or to talk to their friends and family members around, this thing that it might be going on for them. There's going to be some tips and advice in how to navigate the symptoms that they may be experiencing, and then each result section is also paired with, again, local supports that are applicable to them based off of their results, and also digital self-help supports based off of the credible findings that we have cataloged through Credible Mind. And then this is just an example of one of the service pages. So the services are the local resources and programs. This is one that's a literal screenshot from Monterey County. The epicenter, Our Gente, is a safe space for LGBTQIA plus youth. And so if someone clicks on that, they have the information of what this is. There's some cataloging, like what population, so this is for teens, LGBTQ voices, cost information, if there is any cost associated or not, a description, contact information, a link to the website, and maps links, so location and open hours, so that they can literally just click it and go there if they were ready to do that at that time. Okay, so that's all I have to show today. If you have more questions, want a further demo, you can always contact our team. And now we're just gonna look at what's been going on for the past 7 months since we launched.
Okay, thanks, Shamar. All right, so outcomes and data. So again, we launched in November 15th, and this data goes until the end of June. So we have about 7.5 months of data. And I don't think we mentioned this, but this is still ongoing. And so, we're still getting people in, and we will, at least for now, until the end of the year. And so far, the past 7.5 months, we've had over 17,000 visits to the site, and which has greatly succeeded any expectations we had. I think when we were talking about launch, we're like, oh, like it'd be great if a couple thousand people came. But no, it's been way more than that. In terms of actual Wellscreen Monterey completions, it's been a little over 4,300. And our survey completion rate is also pretty high, which has been amazing. I think you heard 15-minute screener. How are people getting through that? Well, for whatever reason, 62% of people who start finish. And so, we don't really know why, and we haven't done sort of the evaluation or kind of post-launch evaluation yet, but some reasons as to that is like we have Google search ads, so people might already be looking for mental health resources. They see this ad, and they're already motivated to kind of complete the screener. So who are our Wellscreen Monterey users? So as we alluded to, a lot of them are 15 and younger. So a little over a quarter, 70% female, 55% Hispanic, Latina, or Spanish origin. And then these last two statistics, which I think speak to the importance of having a tool like this available to the community. So for the people who've taken this, 95% say that they've never received services from Monterey County Behavioral Health, and 86% say that they're not currently receiving treatment or services anywhere else in the county. So that's a very high percentage of people who have an interest or motivation in mental behavioral health care treatment, but are currently not getting that. I won't go over all of the outcomes of the mental health risk outcomes, but you can see here, like a little over half anxiety, moderate to severe, depression, high rate of moderate to severe postpartum depression, even though that's a small subset, because we're only showing that scale to people who say that they're recently pregnant or currently pregnant. And then you could see the rest for bipolar, psychosis, PTSD, and eating disorders. And then on to substance use. So we have two different scales for 21 and up and 16 to 20, and that's because any substance use for 16 to 20 is going to be considered risky. So it's a different scale that we have specifically for under 21. And similarly here, we're only asking questions to people who indicate that they've taken the substance recently, but across all of, at least for 21 up, across all of the categories we cover, it's over half have some sort of unhealthy substance use risk. And so the impact so far in the past 7.5 months, so if you remember earlier, Wes was saying last fiscal year, Monterey County Behavioral Health had a little over 1,300 clients. So we've already surpassed that number in terms of visits to the website. And another great impact is that now thousands of community members have access to something, some sort of psychoeducation resources in their community, Credible Mind resources that didn't have access before, and they're not in services. And what we are also finding is, what we also found during the on-site validation, is when people come to get screened, usually they kind of already have an idea of what's going on, and they just want to focus on that. And so what happens is sometimes you lose the other, like the whole sort of behavioral health dimensions. And so people are coming in for mental health, but they don't want to do anything about substance use because they don't think they have a substance use problem. And so a lot of the times what we were seeing during the validation was people would decline screening for either substance use if they were coming from mental health or vice versa. But with our screener, because we're asking questions about everything, we're seeing that 60% of users have sort of a co-occurring mental health and substance use outcomes. So this is like they have at least one severe mental health risk, so they could be severe for anxiety, and they also have moderate to severe substance use. So, and then this is one snapshot of sort of what do people do once they take the screener. And so as we mentioned on the Credible Mind side, we're really about the self-help, self-care resources. And so that's apps, books, podcasts, videos. And an interesting thing that we found is when people take it, a lot of them really like videos. And so for whatever reason, they're clicking on videos the most. And that has kind of driven us to think about, okay, how do we get more videos on the site, looking into what types of videos are they clicking on, just kind of trying to make sure that we get, as we've said, that this whole process, making sure that we're meeting the needs of the community and the users. And so this last slide, we're just going to talk a little bit about kind of each of our experience and lessons learned so far, and then we'll open the room for questions. Do you want to?
Yeah. I'll take a first crack at it. Monterey County, we're very pleased with this product and outcome so far. And right here too, these lessons learned, we want to hopefully give you all some takeaways to take home with you if you're looking to have a public health outreach and community engagement activity. First of all, lots of demand for mental health education has been evidenced with this program. I think the user count speaks for itself, especially the statistics. 95% have never been to Monterey County Behavioral Health, and 86% have never gotten any mental health treatment, and yet 17,000 users have come to the site. It shows that there's lots of demand out there, and evaluation is ongoing, but I would attribute that at least a little bit to the anonymous. Probably shouldn't use them for it being anonymous and confidential to use the tool. It's very accessible in that way, and then also on the provider side. As we're going out to hand out print materials for promoting the tool, primary care providers and prevention service providers, they're all very pleased to have this tool available in the county. It's something for them to outlet to and to refer clients to when talking about mental health isn't their area of expertise or area to feel comfortable in. The product's been well received across the board in my view. And then youth interest. That's another highlight of this project. It wasn't built with youth in mind, but 26% of traffic is coming from youth. And so that's just indicative of how prominent mental health is among that demographic, how hungry they are for information, how comfortable, maybe it's destigmatized with that population, and maybe like a cultural shift. But it's top of mind for them to explore and check in on their mental health and that of their peers. That's pretty notable. And then the video resources being so highly consumed. Of all the resources being accessed through the site, 69% being videos is pretty impressive. If you're looking for bang for your buck to invest in outreach materials and education materials, video is a good way to go. And then collaboration and relationships have been critical to this project. That's kind of the name of the game, and we've been collaborating with all stakeholders since the inception of the project, and that's really changed as this has been such an iterative project as well, and it touches on mental health and technology and community outreach. It's just really important to have an open door to all stakeholders and be open to collaborate with them. During the planning process, we heard loudly from consumers and potential consumers that they did not want to be diagnosed. They didn't think it was appropriate to be diagnosed through a piece of technology. And then we got into the development phase and tried to figure out, okay, this is an anonymous tool. How could we link that to our electronic health record system? Can we do that? What's this what would that linkage process look like? And that results code is really our key to making that happen. So working with our frontline staff in the clinics and with our quality improvement IT department on figuring out how to create a workflow to make that happen. That was a very collaborative process. And then now currently we have the whole catalog of resources in the database for the tool, but that's always evolving, and there's a lot of nuances to access services in the county. That not everybody can just go to whatever service you see. There might be certain requirements, and so right now we're still in an active phase of making sure that database is up to date and includes the specifics for requirements to access those services. And then we also just want to share technology. We heard loud and clear from the consumers and providers that technology cannot replace humans when it comes to diagnostics. I think there's some ethical issues there, but it's just something consumers or would-be consumers do not want. They don't. It's not appropriate, and also the clinicians. They need to spend time with folks and have that interpersonal dialogue. And even we've received feedback from individuals who've gone through the assessment or the screener and didn't necessarily agree with the results, and that's fine. And, this is built on validated tools, though. So I think even if somebody doesn't agree with their results, this tool is useful as an aid in starting that conversation and maybe just prompting thoughts to, okay, maybe I should talk to somebody. It's just kind of fodder for thoughts and discussion. And then lastly, marketing, outreach, and community distribution plans. In our experience, we just want to start that early. We were so focused on development that marketing was a little bit of an afterthought. And so, we were a couple times thinking, should have started the marketing plan a bit earlier. In part because it's a really good thought exercise on who you're going to reach, how you're going to reach them, and there's really a lot of work involved in that. So start that early, and that can really complement the development of your campaign or your technology development process. And I'll open it up as well to the table to share their thoughts.
Actually, we could go to questions.
Oh,
The next slide.
well, there we go. We can go straight to questions.
I think so. Yeah.
This is so interesting. Thank you so much for this presentation. We actually adopted Credible Mind about 2 months ago, but we did it from the totally opposite perspective. So the health department is doing it. We haven't involved the behavioral health center yet. They're a little bit disconnected from us. So you've given me a ton of ideas. I'm actually actually we did the marketing first. so I think every literal thing we did was exactly the opposite. I'm very curious about what you attribute the high rate of completion of your survey with the kids, the teenagers, the under 15. That is our target demographic. I would love to have any insight on how to better access that particular population and engaging them. So is there anything that you guys can think of in how you rolled this out, how you marketed it, where you're putting it that might have led to that particular demographic being such high utilizers? And I would guess that was why you have so many videos watched.
Yeah, so actually with the 15 and younger, one thing I mentioned is that they're not able to go through the complete screener. They just answer the initial demographic questions, and then they're redirected to a page of resources for youth. From what we saw and what we see across all of our other sites is that especially when we're using digital marketing, that's often the demographic. You know, it's kids that are using Google search, and that's kind of what brings it in. So especially since we launched in November, that has been our primary form of marketing. And as we get more physical forms of marketing out in the community, we might see some of those demographic numbers change. But in terms of targeting that population, I'm not sure if anyone else has any thoughts on that.
Did you use social media? I didn't hear you say that.
We have started to field some ads on Twitter, Instagram, Facebook. Those ads don't always perform as well because you're outreaching to a general population. Anyone who's on those apps is going to see it. Whereas again, for Google search ads, you're going towards people who are actually searching for the information that is related to our content. What we did do surveying with young adults, so like that 18 to 21 transitionally aged youth range, and a lot of them, again, like Wes said, showed a lot more interest in, mental health and in seeking out services, talking about their barriers. So I think just like being able to access the champions in the community around youth or youth themselves, youth ambassadors, youth representatives, youth centers, that's been really important for us for getting the lower end of our 16 and up spectrum. But beyond that, I'm not really sure.
Hi, I was wondering how you went about deciding what providers or resources to include, and how those how people get referred to those specific things. I know maintaining those databases is a mess, so I'm just curious how you did it and how you plan on doing that moving forward.
Yeah. So we really went off of our list of contracted providers, which is a lot. We really do have a lot. And then currently, we're part of that collaboration piece. United Way of Monterey County, who we have a contract with to do our 2-on-1 line, our information line for resources. They've actually developed their own tool, which is more of a closed loop smart referral network of providers really have to actively participate and be a part of their system, but they have a good tool as well. And so right now we're exploring ways to partner with them, leverage their more dynamic and up-to-date database, and have our tools be complementary to each other.
In terms of linkage to a person's assessment results, and in addition to what Wes was saying, we really just tried to cast the widest net. Any mental health related behavioral health providers in the county can be on the site. As with the rest of our online digital resources, we have like Credible Mind. It has 200 mental health topics. So huge range of things that people might be looking for or have associated with their assessment results. We can tag different resources to those various topics and then tag their assessment results to those same things. So if an assessment result is associated with psychosis or depression or substance use, residential treatment, something like that, we can cross-tag all of those things and it'll filter into which resources. We also have some hand-picked lists where people are going through and saying, okay, might be best for someone who scores at a severe level, someone who something best for someone who scored at a minimal level of acuity, the whole range.
Yeah, I think it's there's a lot of work on the back end to just kind of slice and dice everything in categories and create those relationships. So that's why it's a significant workload for somebody, and so that's why right now, looking from now forward, especially as our funding source for this is through the Mental Health Services Act Innovations Pot, for sustainability purposes. That's why we're looking to create partnerships in the community where people are doing that work, and that does exist.
And just one more thought, Credible Mind is also working on our, technological side to create an admin portal that offers self-use of people who are given access through the county to add new resources and services or edit information that is already on the site.
Yeah, and we haven't heard, there hasn't been instances of this, but we wanted to, in case a provider saw themselves and didn't want to be there, or saw that tool and wanted to be there, we want to make it, again, have a means for them to make that known of what their preferences are.
Do you know how many people ended up actually going to a service like a clinician at MCBH or through, referred to someone who was outside of your system?
Right now, to our clinic, and we're it's kind of a rough process right now to monitor for the results codes, and so that's where we actually haven't seen that connection into our clinic by that direct communication of hey, I have a results code coming in, and so the way we're approaching that is just to keep working with our staff through more repeated trainings to work that into their scripts for their intake procedures, and then with the providers, that's we don't. It's kind of hard. I mean, within behavioral health, we can do what we can do, but once we go into providers and they have their own workflows, we haven't really established that process yet. So I don't know. But as a part of that, right now we're distributing print materials to advertise the tool, and also we have another marketing firm involved that is developing kind of like a resource guide for providers to help educate them on the tool. Because there's just a lot of education's involved, so people can work this into their own workflows. But part of it too, I think the users, just looking at the consumption of videos, it's still to be evaluated, but perhaps there's a lot of people that have more mild to moderate needs, and using those self-help resources on the site is doing helping them in that moment, and maybe they'll return to actually proceed with getting in-person clinical treatment.
Yeah, I think the mics are just associated with the streaming and everything.
I want everyone to be able to hear me. So it's okay if you can't answer this question, but I'm just curious in terms of, the potential for this kind of tool. Do you see opportunity, so say this were scaled statewide, is there opportunity for enhanced surveillance when we're just looking even at just community needs that would drive the way local funding is used and decisions and kind of priorities around mental health, and how, so either just using the types of screeners that you're using now, and or including other factors that play into mental health risk, violence in the home or socioeconomic side of those types of things. Are you thinking about that? It's probably too big. I know this is a pilot, so baby steps, but just curious. Thoughts?
Maybe I don't know if Credible Mind might want to jump on this, but we do assess for social determinants of health to an extent, and I think that could help kind of feed into that transition or evolution.
Yeah, I think we're one county now, and I think we do envision a product like this where you start with a screener first, and you can get a picture, kind of a snapshot of your overall community, depending on how many people take it. I think we do want to expand to more counties in California. It would be great to do sort of like a statewide thing, so then we could potentially say like, hey, we're discovering that for the 58 counties, I think, so 30 counties have our postpartum depression is a high risk in 30 of those counties. Like, can we do some sort of statewide initiative around postpartum depression or something along those lines? And I know, Wes, you've taken some of the data, because with the admin portal too, anyone with access can look at the data 24/7. They don't have to wait for us to get the reports. And so I know some of this data has been taken to, we presented at the Monterey County Board of Commissioners, I think another board, but other sort of stakeholders, other sort of stakeholders in the community are finding out about this project, are seeing the data, and we're starting conversations. But yeah, still thinking about sort of a long-term impact and what's going to happen beyond kind of the end of this year.
I'm just thinking in terms of two, like, we have like the CHIS, the California Health Survey, and it's amazing, but its limitations are that it can't really capture that kind of county, community level, granular level data, especially when you start breaking down by demographics, right? But in the meantime, so I mean, we're not really able to either assess like disparities in needs and risk effectively from like a policy level. We also can't track that very well in terms of the impact that our funding and our policies and initiatives are having. Huge barrier. This is amazing because you're essentially capturing really local data in real time. And there's ethical and privacy considerations about how that data is used. I understand that, but I see it as a huge opportunity that would improve my work. Anyway, so I think it's really exciting.
Thank you.
Yeah. I'll add too that I think that if other counties were involved as well, that would help with the piece of integrating this with electronic health records. Because just as one county trying to do it, we use Avatar by NetSmart, and so trying to modify Avatar to accommodate this, that's a lot of work. And so I think to have more counties involved, to have momentum, to work together, kind of similar to some other innovation projects going on related to technology, I think that'd be helpful as well, because that was kind of part of our initial attempt. It's like, oh, can we port this information into Avatar? But since we don't collect personal identifiable information, it's kind of hard to do. And so that's where it did turn it more into a manual process, or at least that linkage piece of using the results code. So I think that would be another area where multi-county collaboration could help if more counties were involved.
Okay. All right, so we're a little over time, but thank you so much for joining us. And there's our email there if you have questions for any of us. We'll redirect your questions. And Credible Mind is at booth 65. And I think I recognize some faces, so definitely said hi to some of you. If you want to continue asking questions, we'll be there too.
Thank you.
Thank you. Thanks.